The fact that 70% of the world's population identify themselves as members of a faith community begs the question regarding what impact religion has on the HIV epidemic. Hello and welcome to another episode of The Last Mile with NACA. I am Adesu Welsi. In Nigeria, Christianity and Islam, the predominant religions, have enormous followers, and the attitudes and lifestyles of members are greatly influenced by their respective religions and the values they teach. This episode explores the role of faith-based organizations in the fight against HIV. You're watching The Last Mile with NACA. Don't go away.
From the earliest days, faith-based organizations, FBOs, have played an important role in the response to the HIV epidemic through their strong links with communities on the ground and their broad network of hospitals, clinics, and other health facilities.
NACA is a faith-based organization that works through religious leaders to their faith congregation with issues around ending HIV/AIDS, stigma, discrimination, gender-based violence, mental health. There's so much that religious leaders can do. So we use the platform of religious leaders to reach to faith congregation. First, one of the things that for us NACA is advocating that religious leaders should use their pulpit to speak against stigma and discrimination. This has been a big issue.
Yes, it's true that about 80-90% of HIV is contracted sexually. But even then, even here, the thing is, the sin is not contracting HIV. The sin is the fornication or the adultery. That is the sin. And I think when somebody is suffering from that, you don't stigmatize that person.
This always brings me to the story of our beloved prophet, Jesus Christ. During his own time, when a woman was condemned, he said, okay, if you know that you've not sinned, be the first to cast the sin. So you look at your own life. What have you done wrong? And now you are overlooking it to look at another person's fault. Remove what is in your own eye before you try to remove what is in another person's eye.
To unleash the full potential of these organizations, there is still a need to reinforce their capacities to adopt new policies and innovations, to improve their collaboration and coordination with partners in the HIV response, and to further address HIV-related stigma and discrimination within faith-based communities.
Some years ago, we did a survey on seeing the level of stigma and discrimination in religious places. So that survey was done in the churches and in the mosques. And the shocking thing about it was the result from that survey was that there is high level of stigma and discrimination from the faith congregation. So we noticed that religious leaders at the beginning were part of the fuel of stigma and discrimination because of the preaching from the pulpit.
Anything that the faith leader, that's the imam, the pastor, said, they tend to accept it as it is directly from God. Sometimes people are not even able to distinguish what was revealed and what is personally from the pastor. So we try to make them understand that you should not, focus on the person's disease condition. He is in a state where he needs your advice, not for you to condemn him. When you drive them away, you are doing more harm.
FBOs also have a key role to play in disseminating messages of hope. Where HIV was once a death sentence, now with treatment there is new hope, because undetectable is untransmittable.
The role of the religious leaders, the religious organization, is to educate people, not to discriminate against the infected. And based on my own understanding, people who discriminate, they are not normal people. They are psychologically sick. It's like their sickness is even more than the people who are infected, because they don't know what may happen with them tomorrow. So the role of the religious leader is to educate and build hope for the people who are infected. And another thing with the religious leaders, the role they should play is to create awareness, to call for seminars, and to preach it on their pulpit during worship services, to discourage people discriminating against the infected persons with HIV/AIDS.
As Muslims, we are not expected to stigmatize people, because something happens to somebody today, you don't know what can become of you tomorrow. So you should not stigmatize people, even if that person is wayward. We are not the one to judge. It's Allah that forgives. That's what the Quran says, that, oh, you, my servants who have, out of their own errors of omission or commission, they have caused perdition on themselves. Do not lose hope in the mercy of Allah. For Allah forgives all sins. That's what Allah says. If He says He forgives all sins, and you say this person has contracted HIV through waywardness or whatever, then you are not the one to judge him. So, from whatever means he or she has got infected, it's not our own. Our own is that this person is passing through a situation that can happen to anybody. Then we should try as much as possible to assist them, to pray for them, not to stigmatize them.
Nigeria's Anti-Discrimination Act criminalizes compulsory HIV testing and upholds the rights to privacy of HIV status results. But some religious leaders demand strict adherence to testing before marriage.
Minerella has been championing this issue for a very long time, and we are not relenting. We are still doing it, and we are beginning to see a little light on it. Probably before now, we've seen that then churches or mosques will always tell couples to go and do their HIV test and every other test. And you notice that when they do the test, mostly when it comes to HIV test, the couples are not aware about their results. The results go straight to the pastor. One, that is their human rights. You're actually bridging the human rights there. They have access, they should have access to their results. So we have had religious leaders who have said, no, once one is positive, they don't want to wear them.
I think that is wrong, because it appears it is the labs. It is labs now that are determining who is qualified to marry for the church. I think what should determine a person marrying, a man marrying a woman, should be their spiritual status, and so on and so forth. If I'm convinced under God, I do the normal counseling and so on and so forth. But when you say it is, they have to go to lab to prove that they are negative HIV. That means the lab that determine for us. Now, in a case where you have somebody who has HIV, one of the couple, one of them has HIV and is willing to marry the other. What moral right, what legal right, what ethical right, what even spiritual right have you to stop them from their marriage? If you are going to prevent somebody from getting married because one of them has HIV, then in a marriage, if one of them contracts HIV because of it, then you should dissolve the marriage. Now, it just does not make sense.
In fact, we should not make it as if HIV/AIDS is the only sickness that is an issue in marriage. If the other partner say, no problem, myself, I have officiated weddings, not less than 10 that maybe one is having it or the two of them are having it, they will say it is okay. Whenever the intended couple said it's okay, it is okay indeed. It is not any other's business to say it should not be done. The church will not be doing justice to say no, they should not be outrightly, they should not be wedded or should not be joined. It is not right.
Over the time, we'll be doing a lot of sensitization. We'll be doing a lot of trainings for religious leaders. And most times, every of our training, these are issues that we engage in. Some of them actually didn't know before now that they can be discordant couple, and when they get married, their children might also be negative all through. So far, the person involved is taking their drugs religiously. We are also working with CAN at the highest level to also start using their platform to also speak this. And we're also working with Nigeria Supreme Council also to also take this to them. We've been working with Council of Imam also to let them know that this we can. And we are happy that there's been a lot of acceptance these days. And we are of the high faith that a lot we keep joining the train and know that HIV is not a death sentence, and these people can still live and live well.
Faith healing and reliance on divine powers and rejection of antiretroviral therapy as preached by some religious leaders can also worsen outcomes.
Yes, we know that yet some faiths actually don't do with drugs, but the thing is, when it comes to issues around faith, we are not diving into, but we are appealing to the religious leaders to also look at from the other side of the people so that they can also continue with their drugs. I've had people, I know of people who are on their drug line. Yes, they also have the faith that they will be healed, but they still continue on with their drugs. So faith is a different thing from treatment. So we don't need to work out from each of them. We need to work simultaneously with them. That's what we can say to this.
People who deceive, they are deceivers. They are deceivers not to be tested, not to accept reality. And not only that, people who operate the church as a business, they are the ones who are deceiving people that don't go for anything, don't access any drugs, so that you come for prayers. God knows there are physical things, there are spiritual things that is only through spiritual way that they should be handled. Maybe through prayer and counseling and maybe encouragement. But there's physical things like sickness, HIV, AIDS, headache. You go to access drugs so that you get solution to it. People who say no, they have spiritualized it, they are deceivers. They are deceiving their members. They have sickness, but not to accept the reality that is in them. It is not right. I discourage the religious leaders to continue to be deceiving people like that. They should enlighten people to face the reality. What God has allowed, God has allowed. And it's only God who has solution to it. Not to tell people not to. Even the drugs we have, the orthodox drugs, it's God that allowed them for us for our own good. Yes.
If you don't see your body, you stand up. If you don't see your body.
Faith-based organizations still oppose the use and promotion of condoms as a prevention method, which can conflict with and negatively influence the national HIV prevention efforts.
This is actually a very dicey one. We had a meeting we were in last week developing an IC material for faith-based organization on HIV/AIDS, and this was a very, very critical topic that we were deliberating on, because some faith says when it comes to condom, you don't measure it.
Preventive from whom? For whom? That's the question. Preventive for whom? The church is against promiscuity. Period. So if we're against promiscuity, we have no business with condom. What are you preventing? In fact, you shouldn't have sex until until you are married. So what do you want to prevent?
As far as Islam is concerned, abstinence is absolute. Because Quran says, "La takrabu zina, innahu kana fahishatan wa sa'a sabila." Do not go near adultery, fornication, for it is a shameful deed and an evil opening the road to another evil. There are no two ways about it. It's either you get married or you abstain until you get married. And the Holy Prophet Muhammad has even rightly given us a kind of solution that if you know you cannot give to yourself, then keep fasting. Because what fasting does, number one, is going to keep your gaze lowered. You won't be looking at anything anyhow when you're fasting. Then when you fast, your mind is is direct to Allah. So in that case, Islam does not support the issue of using contraceptives or using condom.
When it comes to issues around health, I think what we should be looking at is prevention. So you cannot, when we're talking about prevention, you cannot rule out issues of condom out from prevention. So no matter what, we are not encouraging people to have, people who are not married to do premarital sex, but condom is a preventive measure to reduce infection of HIV and AIDS. So it's what we actually cannot run away from, and it's actually what we cannot stop telling when we are talking about issues around prevention. And also, which audience are we talking about it to? So you won't see me going to talk to children and start talking about, okay, you can use condom to prevent HIV and AIDS of sex. So it also depends on the audience that you're talking about. So it's a way of prevention, and you must talk about it when it comes to issues around development.
There is need for sustained capacity building for the FBOs in order to provide them with knowledge on the epidemic and help them act out the role envisaged for them in the National Response Framework in Nigeria.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
Religion's voice in its communities and its ability to stimulate grassroots responses allow faith-based organizations to have a critical role in impacting the prevalence of HIV and AIDS throughout the world. Update segment is next. Keep watching.
In a bid to enhance the operations of the National Call Center for HIV and Related Diseases, the National Agency for the Control of AIDS, NACA, in partnership with UNICEF, recently held a training session for call center agents on a new innovative platform called the U-Test. The facilitator of the Training and Adolescent Team Lead at UNICEF, Dr. Victoria Isiramen, stated the purpose of the training.
We're developing a national HIV prevention campaign for adolescents and young people. It's a national umbrella program that will have different components. And for now, it's called U-Test. We are working to develop a communication strategy that will influence the whole rollout of the intervention using the NACA websites and NACA call center, the National Call Center on HIV and AIDS and other related diseases. What we did is to work with the call agents for them to really understand what the expectation is around this project. They are going to be getting a lot of calls based on the social media campaign that's going to be run on the NACA website. So we've gone through the user journey, we've made recommendations on the kind of information and the frequently asked questions they need to be updated. We've done scenarios of young people calling and how they should respond, and generally give a youth-friendly feel to the whole call center. So this is what we have done.
Dr. Isiramen also explained how the U-Test platform works.
The schematic has a user journey that takes you from a social media campaign, which will run on the NACA website, the Facebook, the Instagram, the Twitter. So a lot of creatives, a lot of engagement and traffic will be driven on that campaign, and that will drive them to the next spot. And the next spot is a chatbot. And on that chatbot, there will be a lot of options of what you might want to do. So one important feature of the chatbot is that there will be a self-risk assessment test. And that self-risk assessment test, when they click on it, it's going to ask them questions about their sexual behavior and other risk behavior that might expose them to HIV. After doing the self-risk assessment test, then you now be referred to do a HIV self-test. And we're trying to make the platform as user-friendly and as low cost as possible, so that this easiest phone, simple feature phone, will be able to go through this user journey.
Some of the participants share the experience.
This is the training that has been spearheaded by UNICEF to inform us about the new program coming up, which is the U-Report, U-Test, to know how to help or create a bridge between the people and the organization, so that they'll be able to get the information required, they'll be able to get the help needed, and all the other support they require. It has actually been very, very, very educative, because they explained a lot of things that we weren't quite versed about. They showed us new means at which to approach our work. They gave us a new way of understanding on how to do the work.
The UNICEF are trying to see how they can engage the National Call Center in working with the HIV self-testing, and then how the targeted population, which range from the age of 15 to 25, can be able to take the risk assessment test on their own. So we in the call center also have a role to play in ensuring that the program is a success.
UNICEF plans to promote the use of HIV self-test and PrEP. So the call center happens to be part of the stakeholders that UNICEF plans to use to promote the use of HIV self-test kit and PrEP. And the whole thing is targeted at adolescents, talking about people of the ages of 10 to 19 years. The training so far has been very interactive. Like, you could see how all of us were talking about the challenges that we face and trying to provide solutions, looking for ways to resolve some of the issues that we've been facing. And at least now, we at the call center, we now know the role that we're expected to play.
The U-Test platform, when deployed, would be an additional tool for National Call Center for HIV and related diseases to provide information and support to the public.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile of NACA, I am Ade Suwelsi. Goodbye.